Hi, everyone. Welcome to Sandy K Nutrition, Health and Lifestyle Queen. Today with me, I have Dr. Leslie Douglas. She is a geneticist. Did I say that right? Geneticist. It's so hard to
Yes.
say that. And molecular biologist. And she is the principal investigator and laboratory director for DNA Connections. DNA Connections is a top US based company focusing on bacterial, viral, fungal, and parasitic molecular based detection assays. Dr. Douglas's professional focus is the research and development of PCR based testing, direct DNA, including Lyme disease tests, ApoE tests, genotyping tests, comprehensive oral tests, gluten sensitivity tests, and propensity tests. But today, we are going to be talking mostly about dental procedures and the potential for overgrowth of pathogenic bacteria. Now, most of you have been following me for a while, know that I recorded a while back with Dr. Kelly Blodgett about biological dentistry. And I'm so fortunate that through him, I found DNA connections. And I really feel honored to be able to be just introduced to people who are doing such amazing things and changing health and wellness as we know it. And today we're going to talk a little bit about some of my own test results, but we're going to get into that later with Dr. Leslie Douglas. And with that, welcome, Leslie. Can I call you Leslie?
Of course, absolutely. Thank you so much. Thanks for having me.
I'm happy to have you on. I mean, you are so knowledgeable about all these tests. So we want to know more. And people who have been following me just want to know more and understand more. So who better to discuss this with than you? So let's get into your background first, because I always
Right.
like to hear about how you got into this.
Yeah, so during undergraduate, I was really into the sciences. I was raised in Hawaii and I ended up with a bachelor's in biology from the University of Hawaii and knew I wanted to go into some sort of molecular based research. I'm just, that type of very analytical person. So I then went on to graduate school. I received a PhD in genetics and molecular biology and took it from there. Found myself at DNA Connections just a little over 10 years ago. And right now, we have plenty of panels, but at that time it was just some smaller panels, and we started working on the Lyme panel. So the panel that we're going to be talking about today is the comprehensive oral. And as we were discussing, people don't have the idea that dentistry can be bad for you. Some dentistry can affect people very adversely. Um, in addition to attracting and being just a site of persistence of microbes that are able to create biofilms and congregate on these restorations and inside the oral cavity. Some of these organisms are commonly found in the mouth, are generally benign. Some of these organisms have been scientifically linked to chronic conditions and different characteristics of the organisms, from, like I said, benign to entirely pathogenic. It's we find them all in the oral cavity. So the panel that we're going to be talking about today is the comprehensive oral. It's a PCR-based panel. It has 88 microbes, 88 potential pathogens, inclusive of bacteria, viruses, parasites, and fungi. Each one is what we call a direct testing method. So we're looking for the DNA of the organism itself. We target live cellular material. And we can basically test any sample from the oral cavity. We can do teeth, blood, cavitational blood, which we can get into in a minute. Um, Site specific, or we even have a full mouth survey with a product called Superfloss. It's an at-home panel. You just floss with the specialized product that's in our comprehensive kit, send it back to us, and we can do a full mouth survey of the pathogens that we find in your mouth.
I think it's a good place to start to, just say, for those of you who are not in the wellness industry, understanding that we have bacteria everywhere is really important. And it's not necessarily that, oh, oh no, she has bacteria. Bacteria is everywhere. It's everywhere. It's more when you say pathogenic, I know you're speaking of the overgrowth of specific bacterias that in an overgrowth stage can be harmful, right? Does that make sense?
Yeah, well, I mean, every organism and each of the organisms that were specially selected for this comprehensive oral panel, it's based on the characteristics of the organism. So we go from benign, commonly found in the oral cavity, to is it microbial resistant? Is it multi-microbial resistant? Does it produce toxins? Can it kill you? So it goes from benign to entirely pathogenic that doesn't belong in the oral cavity whatsoever. And
Okay.
so when you're dealing with these particular restorations that have been done that in dentistry are being corrected or extracted in your case, there's a certain ways that are recommended to treat the area to keep these organisms from becoming a systemic issue. For those that it's already a systemic issue, then there's organisms that are involved in chronic conditions. You've got like your campylobacters or your enterobacters that are related to gut and digestive issues. You've got some, we have streptococcus and staphylococcus species that are related to infection, chronic infection. Certain streptococcus species are related to cardiac issues. So for, these chronic conditions where they just don't understand why they are suffering from it, it could be just the flora in your mouth.
I think before we get into all of this, it's a good for those of you who maybe don't know what happened. I'll try and make it kind of quick, but I had a root canal extracted. And what prompted me was I had this root canal for almost 19 years. So to backtrack, after the birth of my second child, one day my three bottom teeth in the very front, they just crumbled. This is why nutrients are really important when you're pregnant. This is long before I was a practitioner. And then I had a cracked tooth right around the same time. So obviously I had a weakened system after giving birth. There's no other way to describe it. Like your teeth don't just crumble in your mouth unless you have nutrient deficiencies. Period. Like you can't explain that. So I was told you have to have a root canal, right? This is going back almost 19 years. So I did it. And then fast forward, since then, I've been diagnosed with mitral valve prolapse, with mild regurgitation, which I don't have in my family. There's no genetics, but, a heart murmur. This was after I had the root canal. I've also had thyroid cancer. I've also had a breast fibroadenoma. So I've had a number of things. I am a big believer that it's always going to be multifactorial. There were a lot of things going on in my life. So you can't just say it's one thing. But did this root canal contribute to these weaknesses that manifested into issues? Right. So then I went and had a thermography, full body thermography, which showed inflammation in the area where I had this root canal. That was this year in 2024. So I thought, okay, it's time now. I feel like I'm in a healthy state. I think it's time to take this out, even though I had no direct obvious symptoms. So I extracted it. And here we are today, where we're going to talk about what we found, which I think so many people are interested in. And the one big question, Leslie, is how do you even test? Like, so what we did, my dentist made sure that it was put in so I had two roots plus the tooth in a sterile bag that I put in the freezer. And then I waited for the kit and then I sent it off in the kit. Like, how do you get DNA from like an old, like it was sitting in the freezer? So this is all very fascinating to me. And I think we should explain it.
Well, first let's talk about, I mean, there's some people, I mean, maybe when you went to your dentist and said, I'd really like to take this tooth that has been treated. I mean, it's dead. It has a root canal. It's dead, but it's stable. And your dentist must have looked at you like, what, you want to pull out a perfectly good tooth? I mean, there are millions of practitioners, they're called endodontists, and they make a career of
Yes.
providing root canal services. Um, so what is a root canal? Okay, a root canal is when either the tooth is okay, let me say I'm a PhD, I'm not a dentist. Okay. Um, so from my understanding, a root canal is when the tooth is decayed to the point that to save it, they need to kill it. And when they save it, they're essentially saving the structure. So what they do is they access the tooth and they use kind of like these little pipe cleaners and they put them down into the canals of the teeth and they sort of twizzle it, right? And they pull out the blood supply and the nerve. So it is basically, it's dead bone, okay? And then they fill it with different types of material, kind of in a generalized category called gutta percha, okay? Before they fill it with gutta percha, they actually use dilute bleach to clean out those canals. They literally take bleach off the shelf, they dilute it, and they clean out the canals, and then they stuff them full of this product. It's like a rubber or some sort of resin. There's different variations of them called gutta percha. So it's a really essentially long filling, the length of that tooth and the roots. And then they put a crown on top. Sometimes they need to do a buildup or they put in a metal post for more structure because now it's dead bone and they put a crown on top. So some people are absolutely fine in theory with a root canal procedure. They're healthy, it doesn't bother them, it doesn't cause any kind of inflammatory issues. Okay, that would be, I guess, a lucky person. But think about it. So this dead foreign material is now basically disrupting your immune system. Your immune system's kind of like, wow, Sandy, what is that? What is that in your lower right causing your inflammation? And it's always kind of on the immune system's radar to take care of it. Now, because your immune system was entertained by that, is that why you develop thyroid cancer? Right? So, it's self versus non-self. That is a big pile of non-self materials. Dead is dead. It should be removed. But like I'll tell you, I had a crown at my dentist not that long ago, and it was giving me sensitivity. And immediately he's like, "Oh, maybe you need a root canal." I said, "No, no. If I need a root canal, you're pulling it. I would never get a root canal. That's my personal, from what I know, that's my personal belief. I would never do that." Anyway, so there are many people like you that talk to me, that talk to Dr. Bludgett, that is becoming more schooled in holistic dentistry. and how the restorations in your mouth can affect your entire immune system, your immune balance, and your overall health. So what we do, so we have this comprehensive oral panel, and it's, like I said, it's a PCR panel. So we target the DNA of the organisms itself. There's 88 organisms, like I said, and um, some dentists keep our kits in their offices, and some people like you, they hear about us and they order a kit. You can have your kit on hand when you go to the dentist's office. It comes with everything that they need for collection, whether it's going to be bone, tooth, blood, tissue. It comes with sterile plasticware. The sample is deposited into the sterile plasticware. It is packaged up depending on the sample type, according to the instructions that come in the kit. And it includes prepaid shipping to send it back to us via UPS. If you can't ship back the sample immediately, then you freeze it. The freezing process basically just stalls any bacterial overgrowth. So I have people that hear about us after their procedure and they say, oh, my dentist put it in a Ziploc bag and it's sitting on my counter in the kitchen. Like, yeah, that's not going to work. Ziplocs aren't sterile. And at room temperature, you'll have bacterial overgrowth. So what's there will just flourish. So we recommend freezing it until you can send it back to our laboratory. Once it comes back to the laboratory, it's checked into the lab, and we go through several stages of extraction as well as quantification of the resultant DNA that we're able to extract from the sample. We test it for purity and concentration, and then we take that and we divide it over this a PCR-based plate to amplify individually the organisms that are on the panel. The panel results, which we're going to go over, your specific results, show not only how much of the organism, which organisms we detected, how much of the organism we detected, and then our algorithm takes into account, like we said, the characteristics of the organism, and its overall potential impact in your oral cavity and systemically as well. It's a lot.
It is a lot. It is a
A
lot.
lot.
Now, I have to ask, is it possible for it to be wrong, like false positives? I know you explained, obviously, if the sample is tainted, that's a factor. But if the sample was immediately put into a sterile bag and then put into the freezer,
Yeah.
if you follow the instructions, is it possible to get wrong results?
Sure. So that's a great question. So PCR, which is the polymerase chain reaction, which is what we do to detect the DNA of the individual organisms, it's inherently specific. And so what that means is that if the organism is present, the reaction proceeds and you get a positive. And then it's, again, how positive are you? If the organism is not present, there is no reaction that proceeds. And, there's a lot of things that we do to ensure that we don't get false positives. PCR has a starting point, and that's kind of like the secret sauce, as our owner says. The starting point are called primers, and the primers sit down on the DNA of the organism itself. That's how the reaction begins. So if that DNA is not present, the primers don't anneal, is what they call. So the reaction does not proceed.
Okay, that makes sense. That makes sense.
Yeah,
I'm not a molecular biologist, but I think I get what you're saying.
yeah,
I think I get it. Now, here's the other thing, and I know people are gonna ask, okay, okay, this is kind of getting confusing to ask this question, but how do we know if these pathogens are dormant or active? Would it be the amount that is found? Or, like, I don't know if I'm asking the question correctly. Like, is it possible for these pathogens, so they're in basically in levels? Because you guys and we will show this. So if you want to watch it on YouTube or on Rumble, I will have a link to all of this. But you provide in the report levels. Does that
Mhm.
mean how active that is in that DNA, in that piece of DNA, that tooth?
Well, it's more quantity. It's more quantity. So we have another panel. This might help. We have another panel. It's the Lyme disease panel. Okay, so Lyme disease is caused by a bacteria. And when we detect a positive or say a negative, and when we detect a positive, people ask, well, is it active infection?
Mhm.
So we target the DNA of live organisms. So the so PCR, okay, the primers, the start point of the reaction, it's looking for a target within the entire genome of this organism. So the genome of the organism that causes Lyme, Borrelia burgdorferi, is about 1 million base pairs. And that's small. Genome-wise, that's small. But within that 1 million base pairs, we target between 250, not 250,000, 250 and about 1,200 base pairs. So the idea of it being like degraded, sloughed off DNA from a dead and kind of, decaying organism, it's just statistically unlikely that the 250 base pairs out of 1 million that we're targeting is still intact and amplifiable. It's just statistically unlikely. That's
Okay.
one of the reasons why PCR is so specific. Um, its presence or absence. If the organism isn't there, then it's not going to proceed. So if the organism wasn't in the sample provided, it's not going to proceed.
Okay. Okay, that's good. Now, we know that this was extracted
Yeah,
from my mouth.
yeah.
Does this mean that the organisms are gone? The microbes are gone when it's extracted? Or does this mean it's gone systemic into my body and some of them are gone? Like, what does it mean when we remove it? How do
Right.
we know?
So the first thing that you're doing when you remove a root canal tooth is that you're removing that non-self, that foreign object that's been entertaining your immune system. So that's number one. So immediately your immune system is like,
It's like a
we've been
relief.
fighting so long, we won, it's gone,
Yeah.
okay? So we do recommend that, any dentist can do extractions. Any dentist can, perform cavitational surgery, but we do recommend, there are groups and of what they call holistic dental practitioners that understand, like Dr. Bludgett, who understand that when you remove a tooth or when you clean out a cavitation, that there is a possibility that the organisms can escape systemically. So they clean it out with lasers, they clean it out with ozone therapy. It's not just kind of pulling the tooth and you're good. It's about the healing process, as well as the procedure to remove, or replace or correct prior dentistry. Even when you have like metal fillings replaced, you certainly don't want, when they're grinding out that metal filling that contains mercury, you don't want to be, and the dentist doesn't want to be exposed to that. There's certain protocols in place that holistic dentists understand how to do it carefully to protect both you and them.
Mhm. So, and again, we're not giving any medical advice in
No,
this
not at all.
podcast. We are simply just providing you with information so that you can go and explore and educate yourself in this area. That's the whole reason I do these podcasts. So, what I did in advance was kind of made sure that I was cleaned up, let's just say, before I had the extraction. So, I'm a big believer as a practitioner in, toxic load and toxic burden. And I do believe, and this is my opinion, that when you do have a procedure like this, you want to be in a healthy state. You don't want that bucket to overflow. So I have my own protocol on what I did before I had the extraction. Now, I have a dental surgeon here where I am. He's not a biological dentist per se, but I I I trust him, and I think trust is very important. And biological dentistry, I think more and more are coming to be, but they're not there's not a ton of them, right? I would love to see more. So, taking accountability for your own wellness before you undergo a procedure like that, I think is really important, don't you?
Absolutely. Absolutely. And your analogy is great. Like you don't want that bucket to overflow. You said that had this root canal, lived with this root canal, but then, like you said, prepared yourself. That's really wise.
Yeah, actually, Leslie, I did a lot. Like, I was one of
Yeah.
those, like, people who okay, this is so weird, and I have to just mention this. In that whole body thermography, not only did they see this, they saw, some inflammation, thermogenic patterns in the lymph, which kinda makes sense, right, with a root
Mhm.
canal.
Mhm. Yeah.
Um, and this is really weird, but this kinda contributes and people don't think about this. I was doing a gel overlay on my nails for over 6 years. People put gel on top. Oh, yeah. Oh, 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 oh,
Guilty.
Leslie. Listen,
Yeah.
I did too. But when I saw that my fingertips had thermogenic patterns, like, who has red fingertips? This is like you're talking to a girl who did gel nails for 6 years straight, never a break. They were my own nails, but, the overlay, right? With the light and so when I saw that, I'm like, I need to prepare my body
Mhm.
before I get this and remove as many toxins and any insults to myself as I can." So I took them out, took them off.
Yeah.
And
Yeah.
I also did a little bit of a drainage protocol. And I did a few things just to prep my body because I know that my dental surgeon did not use ozone. I know it's preferred, but interesting. I have just a lot of trust in him that he did it in the right way because he's actually worked on everybody's mouth in my family and he's
Right.
very
Right.
highly regarded. So I
Mhm.
encourage people to go with who they trust and
Yeah.
who
Trust and comfort is
yeah,
absolutely,
and
yeah.
experience. He's got
Mhm.
amazing experience. So I just wanted to say that and
Yeah.
I love Dr. Kelly Blodgett. I will put his information as well as yours in the show notes because
Okay.
I did record with him. So, do you think it's a good time to go through some of the stuff on my report? It's kind of juicy,
Are
isn't
you
it?
ready? Are you ready to share?
Yeah, I'm ready to share.
Okay.
I'm ready. We're going to share screen here. So, for anybody who's just listening, we're going to talk about it and explain it as best as we can, but you can also watch as well. Because what I will say, 24 microbes are on my report, just to explain. Only one of the microbes on my particular report was under the moderate risk category. Three of them were in the moderate risk category, and 20 were in the high risk category as pathogenic microbes. By the
Yeah.
way, I didn't even mention, Leslie, like, I had a lot of gut issues too, which I won't get into here,
Oh,
like, a
okay.
lot. It all kind of coincided with the same time that I had thyroid issues. So it's quite interesting the way it all kind of came together around the same time. So let's get into it.
Okay, so is this report up on your screen?
It is,
Can-
it is.
It is, okay, great. Um, so all of the panels that we offer at DNA Connections, there's sample reports on our website at dnaconnections.com under resources. Um, and each one is different. Some have, particular identifiers that are in common, but each panel has a different report. So this is the report. This is actually Sandy's report for the comprehensive oral. Okay, the 88 organisms. So we have patient name, date of birth, who requested it, and this you did as a patient request. And then we have our important dates when the sample was collected, when we received it, when it was tested, and when it was reported. Okay. The sample type is always given. It says unspecified because all teeth has numbers, and you didn't provide us with the actual number of the tooth, so it's unspecified root canal tooth.
Oh, okay. Well, for those of you who are
Yeah,
listening, it's on because there are Dr. Kelly Blodgett actually has um like some pretty cool diagrams because the teeth are living organisms that are connected to our body parts and body areas through meridians. So Dr. Blodgett gets into a lot of that, and you can check
yeah,
that out. And the tooth that was extracted was on my right side, and it's the second molar from the back. And it's the second molar because I had my wisdom teeth extracted. So
okay,
everyone knows it's the second tooth in, not including the wisdom teeth because I don't have those. So that's the actual tooth.
okay. Number 30, I think.
Well, I have no idea.
I don't know, I'm not a dentist. I know that we have 32 teeth, including our wisdom teeth. And the way that I remember it is you start on the right side, because it's the right side to start. 1,
Oh.
16, 17, 32. And 1, 16, 17, and 32 are your wisdom teeth.
Oh, so then 30. Okay, so
Yeah,
anybody
so
who's
it sounds like number 30.
right. So anybody who really wants to look at the connections, they can.
Yeah, yeah,
Yeah.
all the teeth sit on different meridians. Dr. Bludgett's talked to me a lot about that as well. And, especially if you have a root canal tooth sitting on a meridian of, say, your thyroid, that would totally make sense.
I need to look that up. Why didn't I do that
Yeah,
before, Leslie? Oh my God. Too many things to remember.
Dr. Bludgett's shaking his head right now at us
I
going, girl,
know.
I mean, really?
Well, that's his expertise, right? We're talking
Right,
just about the
right.
report and what was found. So,
Right. Okay. So, I know it's a lot of red. I know it looks really scary. Okay. Um, like you said, we report on the ones that we detect. So out of 88, we detected 24 organisms. All right. Now, um, these are based on how much of the organism was detected in relation to the overall characteristics of the organism. Our average for this report, and I've done, I don't know, 10,000 of these. Our average for this report is between 12 and 17 microbes. So you are certainly above average at 24.
great.
Additionally, the sample that gives us the most prolific reports like this are extracted root canal teeth. They are just literally, can I say infested? They are our most prolific samples for this particular panel with respect to the number of organisms and the type that we find. I will say that the superfloss, which is the full mouth survey, those get pretty prolific as well. upwards of, between 30 and 40 organisms, depending on the condition and the state of the oral cavity being tested. So we have some risk factors that are associated. The measured risk factor is what we call, it takes into account the quantity of the organism. Okay, how much did we find? Combined with the pathogen risk factor, which is, again, the overall characteristics of the organism. Does it belong in the oral cavity? Does it produce toxins? Is it microbial resistant? Does it cause periodontal disease? Is it related to chronic conditions? Does it produce toxins? Things like that. So the amount of the organism is measured. The overall characteristics of the organism is the pathogen risk factor. Those taken together is what we call the total risk factor. And that's the kind of the length and the color of these bars on the report. All right. Anything over 9 is a 9 or greater indicates a serious risk. Greater than 7.5, but less than 9 is a moderate risk, and less than that is just an average risk. Again, taking into account the organism and how much of it we found. So you can have something relatively benign, say like one of these actinomyces, they're kind of involved in the commonly found in the oral cavity, involved in infectious processes, but for like this one, the Slendii, there was a lot of it, so that the bar gets longer. It gets redder and longer. Okay. So what I do is I kind of like go through these different organisms. Again, not a doctor, PhD. I'm not a medical doctor. I'm not a dentist, but I mean, I look, and I say, okay, well, I mean, we've definitely got, you said you had inflammation issues. Well, that totally makes sense, because out of the 5 streptococcus species we have, I see 3 on your report. You had Streptococcus mutans, Streptococcus gordoni, Streptococcus intermedius. Also, as far as staph goes, we have 4 species of staph. You had 1, Staph aureus. Everybody knows about Staph aureus.
I don't. I
Well,
didn't.
being involved in infective processes, staph and strep are common culprits. I get a question a lot, and I'll just head it off, because I know some of your listeners are going to say, well, is it MRSA, which is multi-resistant Staph
Mm.
aureus? We don't know. We don't test whether or not this particular staph that we picked up in your mouth is multi-resistant or not. We don't know.
Okay, I have a question about this.
Yeah. Mhm.
You're talking about MRSA. So okay, I have all these pathogens in a pretty high level from that
Mhm.
tooth. We already discussed that it's probably gone. Some of it has gone systemic. It's in my
Yeah,
body.
possibly.
Does
Yeah.
this put me at more risk for something like MRSA? If these pathogens are high, does that question even make sense?
It makes sense, but I don't know the answer to it. I
Okay.
would say that everything that you do to improve your immune system, like removing offending objects like a root canal tooth, is going to give your immune system the best opportunity and preparation to fight off things like that.
Okay.
But that's my own opinion. So I don't really know the answer to that question, to be
But
honest.
you know what? I believe there's one thing to be said about the science aspect, and then there's another thing that
Right,
just makes logical sense, right? Like logic. If my
right,
body is full of bacteria that is not good for me and affects my immune system, it's going to put me at more risk for things like MRSA, right?
right. It definitely would increase your susceptibility to it.
Yes.
You know,
Yes.
I mean, the second that we are born, we are assaulted. We are assaulted with microbes. We are assaulted with viruses and parasites and fungi. It's amazing that we live 30 seconds out of the womb, honestly,
Yeah.
and your load continues throughout your entire lifetime for everything that you come into contact with every single day. I mean, our bodies are just so miraculous. Some of them, they're like, the probiotics that people take every morning. I mean, they're good for you. Bacteria is good for you. It's just, these are things that you just kind of need to educate yourself and be aware of, especially when it comes to chronic conditions. Like, how come some people develop a thyroid cancer with a mouthful of root canals, and then some people don't?
Right.
You know, and everybody is going to be completely different in that aspect.
Leslie, you're going to love this because I interviewed a doctor and I just released the podcast actually this week. And we were talking about how genetics come into play. And then there's resiliency and how your resiliency would be different than mine. And then, your bucket is a different size from my bucket. And, like we are, and I
Yeah.
love this. We are so bio individual as humans. And as
Mm,
much as science does show certain things, you can't ever paint everyone with the same brush. We're all unique. So the best thing we can do is just ensure that we do things to support our wellness, you know?
absolutely. Absolutely. There's a great book about that. Trying to remember the author, but it's called 10% Human. That humans are really just 10% human and 90% microbial. It's really an interesting read. It's
Oh,
an old one.
interesting.
Yeah, I think it was like about 10 or 15 years ago. 10% human.
Super interesting. Now,
Yeah,
looking at this, okay, we see a lot of red. We know
yeah,
that
yeah.
plenty of these tested pathogens were in the high risk. Are there any of these in the red that really shouldn't be in somebody's mouth? Or
Well, like we just said, everybody's going to have a different oral flora.
yeah.
Okay. So what I do next is I take into account patient symptomology, what exactly this particular procedure was, because the bulk of the report, the body of the report, then goes into each organism detected in detail. We have a general description, symptoms of infection, and these are very generalized CDC recommended treatment options, which is one way to go as far as response and therapy if you're going to be treated. Okay.
Mhm.
So, we start with the actinomyces. Like I said, they are normally present in the oral cavity, and we talked about how they were part of the infectious process in dental procedures. Okay. Now, you'll notice that each of these names pretty much is two words. It's genus and species. So we're not just looking at actinomyces species, we're looking at, or the actinomyces genus, we're looking at species that are different within the genus of actinomyces. So in you, we detected Actinomyces neslundii and Actinomyces gerenseriae. Um, and then we go into so everything on the oral panel is species specific, okay? We have, this one's in red. This one is your most prolific organism, which means it was the longest bar, which means that the combination of how much we found and the overall characteristics of this Campylobacter gracilis, this is your most dominant organism, most prolific organism, okay? And it has been implicated in human disease. Other kind of chronic conditions, including gut issues. All right. Then we detected Eikenella. Now, this one says that it is commensal bacteria, which means we live with it, it lives with us. It's found in the oral cavity and the upper respiratory tract. And, there are some, it says here that, that it's a cause of disease in some cases and infection sites. Um, we've got one lesser, rarely the cause, or Gemella morbillorum, rarely the cause of disease in humans, but it is opportunistic, particularly in people that are immunocompromised. It's really up to the patient and the practitioner to look at the report, look at the organisms, um, connect them with the patient issues and symptomologies and chronic conditions. And then that's how you discern whether or not it's something that should be treated, should be watched, should be kept in mind, or something that is just part of your normal oral flora.
Mhm.
And so that's what you do. You go one by one through the report. What I found in your report, which really makes sense, is that there's a lot of organisms here that are involved in periodontal disease, which is gum disease. Now, that could have been the site of the tooth, the root canal restoration just not being happy, or it could be that, and I don't know, that you have periodontal disease throughout the oral cavity. Has anybody ever told you that?
So here's a really interesting thing. M- I so you know how sometimes people again, this is like kind of part of your genetics. Some people
Yes.
just have like weaker teeth or they get more cavities as kids and right? I
Yeah.
never had that. I had two cavities in my entire life.
Mhm.
And I had mercury fillings. I'm a 1970 baby. So back
Yep.
in the day of mercury, I had those removed in my 40s after I had thyroid cancer. And I started to research. I'm like, these things are probably not good. Had those
Yeah.
removed, I think, carefully, from what I can tell. This was when I was early 40s. But I never had issues with my teeth, and my parents, who are 87 and 78, not so bad. My mom worse than my dad. My dad has all his teeth and he's 87. So
Wow.
I know, right? My mom has had a few implants. Now, what's interesting is I was getting a cleaning and it was very aggressive. And I saw all my pictures and I happened to know a hygienist and that's a whole other story, but I do have some issues with my gums or
Hmm.
have developed issues with my gums. And I
Okay.
know people who are listening, they're like, "Oh, this is all hypothetical." I'm like, "Well, no, you can connect the dots and you can actually bring almost like a summary together, and I can do that. I've actually written about this." So, did a lot of my issues begin when I had the root canal? Yeah, they did. They absolutely did. And now, is this the end? I think it's actually the beginning for me, Leslie. I think it's the beginning of clearing out the debris that could be contributing to challenges that I may have with my health. So
So
that
well,
was
yeah,
that was a long story, long answer, but I have noticed some weird things with my teeth, and I have noticed things that don't really make sense because I'm one of those people that's really like particular about my teeth. And
sure.
so, I don't know. I mean, here's another question actually. After I had the procedure, I was put on antibiotics. Now,
After
listen,
you had the aggressive cleaning or after you had the root canal extracted?
after I had the root canal extraction.
Okay.
So I was put on antibiotics and I'm a big believer in the sandwich method as a practitioner. So yes, we're making sure that there's nothing that's opportunistic that might overgrow by taking the antibiotics, but ensuring that I'm continuing to seed and take other more prolific probiotics to ensure there's not because I had after the procedure some gut issues. Like, meaning I had some, like, I just, when you're not comfortable in your gut, most people would,
Yeah,
I can't say something specific. I can't say, oh, I had diarrhea. Oh, I had constipation. No, I didn't feel right in my gut. And I think
mhm,
that going on antibiotics can do that.
definitely.
But what's going to happen afterwards? I don't know. I'm continuing with a protocol. And I'm actually looking at doing a different protocol now that I've healed. It's been just over a month since the extraction. But I don't know. As somebody who sees this kind of thing a lot, what would you do? What knowing your ex and this is not again, it's not medical advice. It's just saying
Yeah,
in your expertise and seeing so much of this, you're looking at my report and it looks
yeah,
pretty red.
yeah. Yeah, well, I mean, just looking at your report, I mean, it led me to, do you have gum issues? Do you have infective issues? Do you have inflammatory issues? I mean, you can see a lot from this report. I can ask the great questions, but as a scientist and not a practitioner, I don't have the answers.
Yeah,
But what I look at is I look at the microbial profile, and I was able to discern all of that just from the microbes that we found from one tooth that was extracted from your mouth. I mean, that's crazy.
it is
That's
crazy.
just absolutely crazy. And I did want to touch a little bit with your listeners on periodontal disease.
Mm,
It's known as gum disease. People may not know that it is caused by bacteria. Um, they literally, and if I offend dentists with my explanation, the way that I understand it is it's basically pockets around the teeth. Okay. So it's areas between the gums and the teeth, and your gums are there to hold your teeth in place. Where in these pockets, if you have gum disease, you have larger pockets, and bacteria can congregate there, and you need special types of cleanings to really rid yourself of that flora. Um, and different bacteria, um, there's 8 or 9 that are really prolific when it comes to periodontal disease. And it could be that this is site specific in your mouth. I'm looking, you have Treponema denticola, Porphyrinus endodontalis, Fusobacteriums. These are all related to inflammatory processes and gum disease.
mm.
Um, DNA ConneXions has a smaller panel. It's called the Periodontal Health Panel, and it looks at the 8 most prolific organisms involved in periodontal disease, because you can brush and floss and rinse and water pick, and you could still suffer from periodontal issues. So in that case, not only can you say, I'm going to look at the bacteria that causes periodontal disease in general, but Miss Sandy, you can look at these specific organisms in your mouth that are the culprit of your specific case of periodontal disease and work on microbial control in a species specific manner.
In a species specific manner, how do
Right.
you do that?
Well, you would talk to your practitioner, because remember, each of these organisms have generalized treatment recommendations. So if you have, let's say, of the 8 um, species that cause periodontal disease, let's say that Porphyrinus endodontalis, which is kind of one of your higher organisms, you can look at specific treatment methods just for this particular species and target that species.
That's interesting. Here's a question.
Yeah,
Okay, you mentioned a couple of different tests. So
yeah,
after you have this one where you're testing the actual root canal tooth, and I gave you two roots as well.
yeah,
There were two roots and then the tooth with the crown, everything in
Mhm.
You have other tests, like, you said the floss. What was that
Yeah.
test?
So any the oral panel, this comprehensive oral panel can be run on basically any sample in the mouth. And if you're having a root canal tooth extracted, we sent you a tooth kit. You know, if
Mhm.
you're having a cavitation area cleaned out, then we send you a blood kit. It's just really just the size of the plasticware. So any sample can be run on the oral panel. Um, all the panels that we offer can be run on a sample type called Superfloss. So Superfloss, it's really thick, it's really absorbent. It's a product manufactured by Oral-B. We take it, we sterilize it. You get a kit. It has, it has the floss in an autoclave packet. You wash your hands thoroughly. You wake up in the morning, you floss your teeth with our product, and you put it in the plasticware, send it back to us. So you can do a site specific, say like number 30. You can floss around, really get down in there, really get subgingival with this highly absorbent, thick floss. And you can do site specific or a full mouth survey.
That's interesting because then you can kinda see what kinda stuff is lingering in the mouth area
Yes.
and what
Yes,
might be an overgrowth.
exactly.
Because logically, if we took out the offending I don't know if I should call it an organism because
Restoration.
it's the restoration
Yes.
because it's dead.
Yes.
It's not a living. If you take that out, technically, then all the bacteria that's within my mouth should go down, right? Would that make sense?
Um, I mean, yes and no. If there were certain bacteria or organisms that were attracted to this area of inflammation, and they were only there because like you had this kind of uh dead area, the root canal tooth, and it's gone, then yes, in theory, some of the organisms that were only present because of that root canal tooth will diminish. But then again, some people just have a really robust flora. You know,
Mhm.
for example, I always go back to this gentleman, actually happens to be my dad, and he's like you. He had one cavity his entire life. He had, and he's very healthy. He eats organic. He lives off the grid. He grows his own food. So I would do oral panels on him, and unbelievably, they were the worst oral panels I have ever seen. I mean, you're
Really?
talking 45, 50 organisms. And we're like, I don't believe it. This is crazy, right? Because you would think the less bacteria, the healthier you are. Okay. So he had this issue. He had a staph infection, a really bad staph infection, where they put him, and sorry, oral panel after oral panel consistently. This is 24 organisms. I mean, imagine this grid has to go to the second page because he had like 45, 50, even over 50 organisms. So he had this staph infection and he was in the hospital. We thought he was going to lose his leg. That's how bad it was. And they put him on prolific IV antibiotics to fight whatever it was that was causing this infection. So he overcame it. He was out of the woods. And I said, great, let's do a series of oral panels and see what happens.
Yeah.
So after being on these highly prolific intravenous antibiotics, we did his oral panel and he was down to like 10 organisms. There was nothing there. It completely wiped out his flora, good and bad. And over the months and over the years that followed, he built right back up to that 50 plus flora.
Interesting.
Some people just have a very robust flora that doesn't affect them, their oral cavity, or their body systemically. Some people just do.
Wow.
So That's why we say every panel that we do needs to be taken into account with what we find and patient symptomology.
I'm gonna,
It's really important.
is it okay if I stop sharing this, Leslie?
Yeah,
Okay.
yeah,
Um, because I think this is really important, what you just mentioned. So two of the courses that I took in college, in nutrition college, were on symptomology, just specific symptomology. And what you said there made so much sense about your dad,
yeah,
because I do believe, and it's like you're born with a very unique microbiome. Maybe it works for you. This is why, you know what I'm saying? Like,
yeah, yeah,
maybe it works for you. I just happen to have some real health challenges that, I can surmise that came after the root canal.
yeah.
Is it 100% because of that root canal? Well, I think the root canal might be one of the offenders. One.
Mhm,
But there
mhm.
could be multiple offenders. So this is just such an interesting conversation because it is science, but it's also about bioindividuality and symptomatology and all these things. So I think it's I think it's important for people to really have that self-awareness. Like, what's going on with me?
Right. And I mean, I know it's so hard to, you've gone to a dentist for advice, for treatment, for care. And this person who is educated says, you need this. And it's really hard for a person to say, I don't want that.
Yeah.
What are my other options, right? One other thing that's we can just touch on really lightly, but I think is so important because we're talking, I love that term you just used, bio-individuality, okay? So there's a whole, and Dr. Blodgett might have brought this up about biocompatibility in dental materials. So we have a second laboratory here and we work with um, a serum sample, a blood serum sample, and it's a protein agglutination assay. So we are looking at what is in dental materials. I mean, common dental materials and how each person has different levels of reactivity to the components that are in dental materials. There's a lot of information on the website. It's called BioComp Laboratories. And maybe that's the next panel we'll do on you.
Mm.
Um, so that panel, it's so interesting. We have what we call components and we have products. The components, there's 78, soon to be 82. In like 2 weeks, we're adding more. These are metals and non-metals, things that
So
are in
cool.
dental materials, titanium, copper, lead, cadmium, organics like phenols and quinones. Why are those in dental products? All right. So each one of these components comes up as least moderate or highly reactive to a patient's individual sample. And then the second part of the report is our database of dental products. And we add new ones every single day. We have over 11,000 dental products in our database. These are common products. These are products that your dentist uses, that my dentist uses. And so he says, okay, you need a crown, right? So what kind of crown is he going to use? Does it have metal in it? Are you highly reactive to that metal? Is it a porcelain? Does it have aluminum in it? And so each one of these products are listed by the specific product name and manufacturer. So let's say in that first part of the report, you come up highly reactive to copper, right? Copper is pervasive in dental materials. So any product in our database of 11,000 dental products that contains copper will be listed as highly reactive for you and to avoid it.
Okay. That,
I know, right?
oh my
Mind
God. We
blown.
are such geeks, aren't we? Like, look,
I know. I'm such a nerd. I'm such a
I
nerd.
love
Yeah,
it. I love it.
yeah.
You know why? So, okay. I'm going to backtrack a little
I
bit.
know it's a lot. It's a
It's a
lot.
lot. It's a
Yeah.
lot because here's the thing, and this is, I think I've been called to do this, Leslie. Like, just bring attention to this. It started with Dr. Blodgett, and what happened. Here's what's really interesting. And for all of you dentists, I always say, if this triggers you, then maybe you got to just take a look in the mirror because I'm only just saying this because I want to bring awareness so that it doesn't happen to other people. I had a
Yeah.
tiny, so this was right after I interviewed Dr. Blodgett. I had a tiny, tiny little crack, and the dentist that did the procedure took the enamel off, said that he needed to do that in order to put a crown on it so that it saves the tooth. I developed a condition called condensing osteitis. So the reason he did it in the first place was I had just very mild sensitivity. And I love Dr. Kelly Blodgett's approach to these things, where he's like, if somebody has mild sensitivity, we might just do a little bit of bonding, like not anything too aggressive. And one of the things that he said, and I just so resonated with this, is he said, it's not the dentist's fault in 99% of the cases because they're taught to almost treat the tooth like it's a piece of wood, but
Yeah.
it's a living organism.
Yeah.
So the tooth was treated like a piece of wood, unfortunately for me. And it's weird because I'm like, here I am already knowing about this, and then I allowed that to happen. And then I developed condensing osteitis, which means it's just like inflammation into the bone. So then that same dentist said, oh, well, now you have to have a root canal. Yeah. And I said no. And then I took the whole tooth out. I decided to just take it out.
Yep.
Now, here's where we get into that whole thing that you were saying about the composite testing. And people who are listening to this are probably going to think I'm weird, but if you know who I am, you're good with my weird. I actually I actually am a big believer in muscle testing for myself to know if my body resonates with something or not. So I was toying with the titanium, ceramic, titanium, ceramic. And this is the big thing. Remember, I was saying I really trust my dental surgeon, and he uses, so there's some research. I looked at it about certain alloys of titanium implants can cause problems in people. So they suggest, if you've got a dentist that has some back product that's God knows how many years old, that they just maybe they don't do a lot of implants, right? Like, you have to be aware of this
Yeah.
as a patient. So I knew
Right.
exactly the brand, the year, I knew everything about this titanium, and I actually allowed for the titanium implant. But now with this root canal extraction, I will do ceramic because I don't believe that two metal titanium posts in my jaw are a good idea. And so testing for, what did you call it? Uh, bio.
Biocompatibility.
Oh, that
Yeah.
is so crazy
Yeah.
and
Yeah.
valuable.
Okay. Well, if you're going to get a ceramic implant, then we definitely need to do a biocomp test on you because I would say almost daily, people call me and they say, Leslie, they say, I'm allergic to titanium. I have a titanium implant. I'm allergic to titanium. And I say respectfully, I mean, while it's possible, probably not. Titanium implants are usually 94 or 95% titanium. It is the amalgam or the mixture of metals, like you just said, what is in that other 5% of that implant that that's what they're reacting to. So remember my example, like let's say you're highly reactive to copper, right? If you
Mm,
don't know that, and you said I did research on this implant, I know exactly what's in it. Is it 2% copper? We will be able to tell not only that you're highly reactive to copper, but we take what those, each individual implant, I said we have 11,000 dental products, what each individual implant is made out of when we put it into our program that way. So if it has copper in it and you're highly reactive to copper, it ends up in your highly reactive section. Now, I don't know about, I mean, for years and years and years, they were saying titanium implants are the best. This is the Cadillac of care. Now they're saying, oh, well, it's ceramic implants. That's
Yes.
the way to. Did you know a lot, not all, a lot of ceramic implants have bound aluminum.
No, I didn't know
They
that.
do. A base of ceramic implants is either aluminum oxide, aluminosilicate, or alumina, which means that it is aluminum, but the aluminum atoms are chemically bound by other atoms, the
Mhm.
oxygen or silicate. So a lot of dentists think that that means that it's chemically bound and therefore inert. But what happens over the life of that restoration with chewing forces and temperature changes that the oral cavity is subjected to? So, not all dental implants, not all dental products are created equal, and don't you want to know before you have that implant placed, not after,
Yeah, that's beyond, because who wants to go through that again? Ugh.
right? Yeah,
Um, that is beyond brilliant because here's the other thing. I don't know if you saw my tooth, but you could see the crown because this is like 19 years old. There was metal around, like this is an old crown that they put on the root canal tooth, and
right,
it was
right.
always a silver lining around it.
Yeah,
So the crown probably also had metals that was on that root canal tooth, right?
probably. Yeah.
Especially if it's
It's
not,
probably what they call it. I mean, some crowns are like a solid block of porcelain or ceramic. Some they call PFM, which is a porcelain fused to metal. So it has a metal base with a white crown on top out of porcelain. So yeah, I mean, likely because it was
yeah,
so old,
because it was
likely.
sold. Yeah.
Yeah.
So I
Again, the
asked,
standard of care changes.
yes.
Yes.
And so I asked about this one, the crown that is on the titanium post. And it's so
Mhm.
funny because I had to learn all of this. Like, I'm like, what is an implant? Like, what do they do? Like, I didn't even understand it. I'm like, you could put a post in my jaw. I'm like, what is this bone grafting stuff? Like, what is it made out of?
Right.
The
Right.
thing that's really important to gain from this conversation, this was such a good conversation, Leslie, is to question and ask everything. It's your right as a human being and your health to ask these questions and then find a practitioner that A doesn't get offended when you ask the questions, that
Yeah.
B has some knowledge of like testing like yours so that they can say, okay, let's piece all this together and get the right protocol and plan for your best health. So I just love what you guys do. I love that you do all these different tests that really support our dentists, our doctors. I just love it.
Yeah, I mean, it is. It's support for patients, it's support for practitioners. You know, I tend to scare people a little bit, but knowledge is power.
I'm with you. You didn't
Absolutely.
scare me. I mean, you kind of did. You kind of did. But then I'm like,
When you saw all the red on your report, you're like, oh no, what is that?
but at the same
Yeah,
time, I actually wasn't that surprised either because of the things that I've learned
yeah,
about
along the
root
way.
canals.
Exactly.
And
Exactly.
one thing I will say, I'm not telling everybody to go out and, what although there is a documentary, Root Cause, and it was very much poo-pooed by I think the American Dental Association's very criticized, but I tell everybody, put your critical thinking cap on, watch it, and just kind of learn and take what resonates with you from that documentary.
Right, exactly, exactly. And, you know, everything that we've talked about here today, food for thought.
Yeah,
You know, there's
yeah,
so much great literature out there. There's, panels that you can look at. We're here. I mean, I've been here at DNA Connections for just a little over 10 years. And, we're always working for new panels and, just to bring awareness to a huge part of people's healthcare that they've never thought of in that terms.
yeah, and think of all the things that you can prevent, because 'cause I'm always about
Yeah,
prevention. It's so much better before, you get a diagnosis. So,
absolutely.
yeah.
Absolutely. Yeah.
So please let us know where we can find you, where we can get information, where we can, you know, get your kits because you have the Lyme tests, which you're very well known for. Let us know.
So everything, the two labs are in the same building, here in beautiful Colorado Springs. One is DNA Connections, and so that's DNACONNEX as an X-ray, IONS. We're making the connection between overall health and microbiology. And then the second laboratory for that serum biocompatibility is Biocomp Labs, BIOCOMP LABS.
Awesome. And I will have these links in the show notes as well. Thank you
Great.
so much for coming. I love this
Thank you for
conversation.
having me. Thank
Yeah,
you for having me.
it was really fun. Thank you.
Thanks so much, Sandy.
Um, okay.